As a nurse, talking with healthcare providers is second nature. And in the beginning of my work, I didn't realize how challenging it can be for people who are unfamiliar with the healthcare setting. I know that the healthcare system uses language that can be intimidating, settings that can be intimidating, and a lot of people who come in and out of one's life that are unfamiliar, that are imparting really significant information in stressful times. So the whole system can be pretty intimidating. The goal here in this presentation is to help families become more comfortable and realize that they can establish a sense of partnership with medical providers, whether it's in a doctor's office or a nurse's office, whether it's in a hospital or a nursing home. Communicating to the providers that you all have a common interest in providing the best for the individual who is the center of care. One of the fundamental questions I think people need to consider is, what do you want to accomplish? What do you want to get out of this visit? What are your concerns? What are the things you want to address with the doctor? What do you want to leave the office with? So having a list of questions is really critical. Having a set of priorities that you want the doctor to address. Very often I will coach families to say, "Doctor, I want to take 3 minutes of your time. I have 3 questions." Oftentimes people feel like, oh, the doctor's too busy, he's too rushed. If you give the doctor a sense of what you want to accomplish and the time frame that you think it will take to accomplish it, he or she will be much more comfortable. So be specific, asking questions. The other thing that I've noticed with older adults that I work with is that so many of them seem to have their social life confined to going to doctors. It's not uncommon for individuals to go to the doctor and the doctor to say, "I'll see you back in 3 months." And when I ask the person, "What are you going back to the doctor for in 3 months?" they will often say, "I don't know." So find out, is there an important reason to go back every 3 months? Is there a chronic illness that requires monitoring? Do you need to make sure the medication that's been ordered is having its hoped for effect? Or is it just becoming this rote thing of come back every 3 months? It might be legitimate, but it's also a legitimate thing to ask if you're not sure why you're returning in 3 months, to say, what is the purpose of this visit? And might we increase the visits to every 4 months or even half a year if there isn't an acute problem going on? Become active in conversations about what you want from your healthcare provider and what you want to accomplish. Another important part of going to the doctor's visit is to look at medications. It's quite common for individuals to leave the doctor's office with prescriptions. And certainly medication can be life-saving and create longevity and high quality of life, but there is a problem with polypharmacy, the use of too many medications. Many hospitalizations, many illnesses are caused by drug interactions. Medications, while life-giving, can be a blessing or they can be a curse. So be aware of what medications you're taking. Always take an accurate and complete list of medications, or even all the medications, to the doctor's office, and make sure that you understand why you're taking a particular medication, what its side effects are, what its benefits are meant to be. Sometimes medications are prescribed and they don't have the benefit. The doctor may not ask, "Are you feeling better?" It's up to the family or the older adult to say, "You know what, I'm not feeling any different." Likewise, it's sometimes possible to say, "I've been taking this medication for 3 years. Would it be possible to take a holiday from this medication?" Most doctors are apt to prescribe medication. They're not as apt to withdraw medication. So very often it's up to the family or it's up to the older adult to say, is it necessary to continue this medication? It might have been perfect a year ago or 2 years ago, but it's not necessary anymore. So revisit that decision. Again, it's active partnership with your provider. When tests or procedures are ordered, it's very important to know what is the purpose of the test, what is the purpose of the procedure. There are so many technologies available in healthcare that they are almost automatically ordered, even when they're not necessary, or that the information is going to be academic rather than really instructive in guiding the care of an individual. So my rule of thumb is if the information is going to impact on decision making or impact on the interventions, then it makes sense to pursue a test. If it isn't going to guide decision making or change the course of the illness or the intervention, it might be better to just say, you know what, let's take a watchful waiting approach, doctor. I prefer to just see how things play themselves out without a test or a procedure that can sometimes be very costly in physical well-being. If an individual has dementia and they require a certain level of care, you don't need neuropsychological testing to help you with that diagnosis. You already know the facts, and dementia care most typically is not altered by the findings of a neuropsychological exam. So asking questions, being an astute consumer of services, not only for economic reasons, but again for the toll that some of these tests can take on the older adult. A phenomena that's occurring in healthcare these days is the phenomena of the hospitalists. So many individuals are going into the hospital and finding that the doctor they see in the office is no longer attending them in the hospital. So you have individuals who are unfamiliar to the older adult and to whom the older adult is unfamiliar, as well as often a raft of specialists. So you want, as a family member, to advocate for the older adult. It's really, especially now, incumbent upon family members to communicate to the hospitalist who this person is, how they were functioning before the illness. Were they going out for martinis with their neighbors, or were they confined to bed? Because that pre-illness situation is going to impact on the treatment and the outcomes that one are going to experience. Communicating to the hospital and to the specialists who this person is and what you want to accomplish, what your goals are, is critical, and increasingly so as healthcare becomes more fragmented. Very often something can be treated, but it's not necessarily going to produce the results that somebody wants. Most people want treatment that's going to return them to their pre-illness state. Treatment doesn't necessarily mean that they are going to return to their pre-illness state. And that's something that's important to be clear about when the doctor is prescribing a treatment or a procedure. Be aware that the treatment might not get you what you think you're going to get. When asking a doctor what is the likely outcome, sometimes doctors will say, I really can't tell you. My encouragement is to counter with, well, give me an educated guess. When you're dealing with professionals, you're dealing with people who have been educated and have experience, I think it's incumbent upon them to give an educated guess, even if they are not giving guarantees. So if you communicate to the doctor, I'm not looking for a guarantee. I'm just looking for the best information available. I'm relying on your expertise to guide me in making a decision. If we want a procedure to return Dad to home and the golf course, and that's not likely, we want to know that. The adage is the squeaky wheel gets the grease. In this instance, I don't necessarily want you to be squeaky or undiplomatic, but I do encourage you to be informed, be an advocate, and be a partner, communicating to all the people that deal with your older adult in a hospital or in a healthcare setting that you want to create a partnership that's going to serve the best interests of the person that you love and who has the most stake in the decision making.